So to share more about what hope looks like in constructive acts of service and partnerships between faith entities and clinical health care providers, I am delighted to introduce this afternoon Brandon Lackey, Chief Program Officer at the Foundry Ministries in Bessemer, Alabama. He will be followed by Teresa Cutts, Assistant Professor of Social Sciences and Health Policy at Wake Forest University School of Medicine in Winston-Salem, North Carolina, and Joy Sharp, Director of Community Health Program at Baptist Healthcare in Pensacola, Florida. And I think we all had thought it'd be wise to have people go through their presentations, because as you're wondering, and your questions may be answered in the subsequent presentation, so we'll do that. And I'd like to now welcome Brandon to the stage, to the podium.
Good afternoon, everyone. It's good to see everyone's happy, smiling faces. My name is Brandon Lackey, and I'm the Chief Program Officer at the Foundry Ministries. Let me take a moment, and since no other speaker has done this today, I want to thank the Academy. I cannot believe someone hasn't done that already. If I was to receive an award, I would want it to be from this academy and not the other one. So, and my 11-year-old nerd son would agree with that statement. Thank you to the members of the round table. Activities like this, events like this just don't happen by chance. It takes a lot of intentional work. And so thank you. Thank you to Shaw University, and also to you for staying for an entire day. You deserve a round of applause yourselves. But it is my honor to represent such a broad spectrum of agencies and organizations, ministries, and faith perspectives today. I am a husband, I'm a father, soon to be foster father. I am an administrator. As Chief Program Officer for the Foundry Ministries, I am responsible for all the programs, which include all 413 of our residential beds. And so every night when I lay my head down on a pillow, well, sometimes it takes a little while to go to sleep when you begin to think about the individuals and their stories who are hoping for a changed life. See, I began in this line of work about 25 years ago as a volunteer. And so I also have a strong appreciation and want to say thank you to everyone here who has ever volunteered in your community, in your church, in your hospital, wherever there was a need. There should be more volunteers. See, growing up, I would have been considered to be in a number of the marginalized populations that have been mentioned throughout the day. Matter of fact, the Foundry Ministries is located in Bessemer, Alabama, which is a suburb of Birmingham, Alabama. It's in western Jefferson County. And during my teenage years and after, I did everything possible to get out of Bessemer, Alabama. I'm the first in my family on either side to graduate college. I did not see a dentist until I drove myself to see one. I did not have health insurance until I found an employer who would pay me enough to purchase my own health insurance. I was a minority in a minority community, and so I had every reason to fall into some statistical outlying results. But I didn't. And I have to credit my faith as one of the major reasons why I'm not a statistic today, and why I'm in a position to volunteer and work in the helping professions instead of having to rely on the Foundry Ministries today. It very easily could have been different. So my faith, as well as the men and women that God placed in my life, who showed me how to make the next right decision. And so, again, it's my deep honor to share my story and the Foundry story with each of you today. As you came in, you were given some handouts, and I'm going to reference a couple of them there at the back of this packet right here. And then the first one looks like what's on the screen above us. The Foundry Ministries began in 1971 as your typical homeless shelter. Imagine your Association of Gospel Rescue Mission soup kitchen. When I would drive by it or be driven by it as a child, the men who stood outside of it scared me to death. They operated a little thrift store, and one day I drove myself down there and I browsed through the merchandise, and I was panhandled when I went in, and I was panhandled when I went out, and that was my experience with homelessness in the Foundry. But 21 years ago, our founder, our visionary, had a different plan for the Bessemer Rescue Mission. He wanted to cast a big net and catch as many people as he could who had big problems and who needed big answers. He wanted a place where individuals with life-controlling problems could be invested in their own life recovery. If you have ever worked with clients or patients, you know the ones who actually want to get better, and there are those who think they want to get better. And it's usually a joy to work with those who are actively involved in their own life recovery. And so when Pastor Bill came to the Foundry, he was given a chance to speak to the men who were there and the staff who were there. He said, God's given me a vision for a place called the City of Hope, which became the Foundry. And it's a place where people are invested in their own life recovery. And he began to explain what that looked like. And he made the offhanded kind of joking comment that if you're not interested in being invested in your own life recovery, then you probably don't want to be here on Monday when me and Miss Michelle arrive at work. And so that Monday came around, and don't get too far ahead of me, but there was no one at the Foundry when he arrived. Those men left. They were not interested in doing what was required, but it opened up an opportunity for men and women who were interested in changing their lives. And today, the Foundry operates facilities in 6 different time zones, or 6 different zip codes, not time zones. That's I hope that's not a prophecy on my watch. If my boss is watching, I'm sorry. You see, I'm reminded of we'll call him Kay, but Kay is a program participant in our rescue department. He's a volunteer, but he's also a participant. But he's also a volunteer, but he's also a participant. You see, we believe that a healthy environment involves healthy relationships, and when we enter into that relationship on a level ground, where we're not just handing out, where we're not just telling someone how to do something, but we engage them in that process, our outcomes are better. And Kay is in a wheelchair. He has no transportation. He comes to our Tuesday meal because he is hungry. But Kay is going to be the person who greets you at the door with a smile when you come for your meal. It's for Kay and people like Kay that I'm here today. I could not do what I do if it was not for the men and women that we serve who were invested in the Foundry itself and in their own life recovery. Pastor Bill wanted a healthy faith-based community environment where the cycles of poverty, addiction, and incarceration could be broken. It's a progress-based program and not a time-based program. But for those of you in the room who can acknowledge this with me, time is on our side when working with homelessness, poverty, addictions, and incarceration. We have what we call our 3 R's. And no, we're not pirates, but we have 3 R's. It's rescue, reentry, and recovery. We're best known for our recovery programs, and it takes up the bulk of our residential beds. But I will share a little bit more about those in just a minute and the collaborations that help us do what we do. I've been at the Foundry for 5 years now, and they had a history of collaborations before I got there. But I have to say that one of the biggest joys of my time at the Foundry has been the support of our leadership team in being innovative, of doing it a little better each day. Well, it didn't really start out that way 5 years ago. 5 years ago, I found myself at a homeless transitional facility called Changed Lives, which is managed by the Foundry. I had just spent 12 years in working with men and women who were in recovery, and I didn't know, well, you could fill a dump truck with what I did not know about homelessness. And here I found myself in an entirely new field, asking God, are you sure we got this right? I was overwhelmed. I was over my head. I had a meeting with one of the experts in homelessness in Birmingham. And I asked her, who are the 3 people I need to talk to, and what are the 3 books that I need to read? That was my very first meeting in my first week. And I don't know who told me to do that, but I would thank them right now. But it didn't take me long to realize I couldn't do this by myself. I had to have outside help because the need was so overwhelming. I was completely humbled. See, I sat down at dinner with one of our program participants. We serve a meal 3 nights a week for anyone who is hungry, and we'll call her Sister M. And Sister M said, I was asking about our services. I said, why do you come? Why come to Changed Lives to eat? There are other places to eat in Birmingham. And how often do you come? And so she looked up from her food, and it's a little picnic area with a picnic table. And she said, I come because I feel safe here. I feel loved here. And I come when I need to, when I'm hungry. I don't know about you, but it made my heart sing because that's exactly the kind of person that I want to influence. Sister M had shared the rest of her story. She came from the Carolinas and drove to Alabama because of a mental illness. And she found herself in a broken down vehicle outside of the Salvation Army. She would not go in the Salvation Army because she had a fear of enclosed spaces. And so she was living in an inoperable car and relying on the kindness of others in the agency to assist her. I knew I did not have what it took to help Sister M. I sat at our conference table a few days later, and I had scratched out on a legal pad what I thought needed to happen program-wise for individuals to have a shot at success. In 3 pages of handwritten notes, I am overwhelmed again. I'm overwhelmed for myself, not including the men and women that we served. Dear God, how in the world do I communicate what resources are available, what needs to happen? In the second slide and the handout that you have is what came out of my, can I call it a quandary today? I'm a visual person, and when I need a visual aid, I often go to Google and I Google images. And does anyone in here enjoy board games? Come on, wave at me. It's participation time. Who hates board games? Like, you would rather go to the dentist. One guy. Thank you for being honest. I love board games. I would pay my siblings to play me so I could beat them. Really. So I'm sitting at this conference table, I'm Googling, and I had this idea because I knew 3 pages of legal pad handwritten notes was going to accomplish nothing. And I remembered the game of life. Anyone ever play the game of life? Okay. Google it if you don't. I'll give you permission to look it up on your phone right now. But you spin the little spinner in the middle of the board, and you have a little car, and you get a job, and you get married, and you get little kids that you put in the car, and you try to get to the end of the map. And I don't even really remember what the outcome of the game or how you win it, but I remember playing it. And I found I looked up the game of life, and I was like, this is way too complicated again. But I found a version of the game of life that had been discontinued. It obviously had not sold very well. But there were 4 different paths that people could take to get to the finish line. If you'll bring up the second handout for me, please. And I just named it a life plan. And yes, my program participants looked at me like I was crazy when I brought this out the first time. It's this handout right here as it loads. And I have to explain it. I know you can't read the little boxes, and you don't need to read the little boxes. But there are 4 ways that program participants progress through our programs. There's Life You Earn It, which is the red section. It covers everything from SNAP benefits to full-time employment to budgeting, savings and checking accounts. Then in the orange section is Life You Learn It. We have heard from a number of speakers today with all kinds of letters and numbers after their names. And no matter what happens, no one can take away your education. It's important. But in our homeless center or our reentry program, it may start with something as simple as a to-do list, being your next best decision. A to-do list, reading 3 books, and they can't be comic books, right? Credit repair, financial classes, GED, trade school, or a classical education. It's different for every person who walks in the door. I know this isn't amazing stuff. These are things that social service agencies around the world deal with. But this is what my people needed. This is what our people needed. The blue section, Life You Live It. These are the nuts and bolts of life. These are things like cell phones and email addresses, health insurance, transportation. And then Life You Love It. You know what? I work with a lot of folks who just survive. I work with people who have not thrived in a very long time. And I consider myself and our program to be a failure if we're just getting people back to surviving when we have the opportunity to help them thrive. Now, why did I share all that with you? It looks pretty. There's multiple colors there. The copy business company, they love us when we print these off. I very quickly realized that even though I had found a way to communicate some next steps, I was not the expert on many of these. What I was a connector of persons and resources. See, at the Foundry, we don't accept federal funds. We are a faith-based organization. We are who we are. And I began reaching out and asking people what they do. Wow, that was loud. Sorry, I thought I'd turn that down. Be who you are, but reach out and find the experts in your field. Look at the needs of the clients that we serve and identify the people in your community who can help meet that need. So we call it a collaborative continuum of care. If you're at the Foundry, you can receive up to 40 months of care. But we can't meet every need that people have. I'm not a lawyer, so I don't give legal advice, but I know some lawyers who do. I'm not a doctor. I don't give medical advice. The Foundry does not diagnose, it does not prescribe, and it doesn't treat. We're part of those wraparound recovery services that Heidi mentioned earlier. But our folks need specific answers to very important questions and problems. And we don't talk to each other. We work with high target or high risk populations, HIV, hepatitis C, prenatal care, diabetes, cholesterol, blood pressure, those who are incarcerated, and of course, with the opioid epidemic, we're dealing with an incredible rate of overdose right now. And yet the agencies, and it's not just in our community, it's in other communities, we just don't do a good job of communicating with one another. So I wanted to be part of the answer. I want to be part of the solution. I did not want to be a part of the problem. And I wasn't getting what I needed, and so I decided to go out and find it. Next month, I will take my management team to our 26th agency, outside agency. Every organization here has a business meeting of some kind. I just don't do my business meetings at the Foundry anymore. I pick them up and I take them somewhere else. It builds relationships. I take my team to places where maybe we don't agree. Maybe we do agree. Maybe we do things differently. It's good to have a conversation. It's good to sit down and talk. It's good to hear a different perspective, especially when it benefits our clients and our participants. Some of the things the Foundry has done through collaborative efforts, and we're very honored to be good stewards with these relationships, but we have a great relationship with the UAB, University of Alabama in Birmingham School of Nursing. We actually have a community clinic. It's called the Foundry Clinic. And it has been in operation for a number of years. And our Foundry Clinic staff now work at the federally qualified healthcare center just around the corner. And so they received training on site with our population way before we had a qualified health clinic. And now they're actually able to help even more people than they were before. We run a dental clinic since 2011. And in the first year, the founder of the dental clinic, they wanted to discount or give away about $1 million worth of services. Well, in their first year alone, they gave away or discounted $4 million worth of services. And they have done $2 to $4 million worth of services every year since. You can't find a parking space at the Foundry Dental Clinic. Why? Because the best doctors, it's a teaching clinic. They come in and learn special techniques and practices. It's a world-class center because world-class doctors come in to learn and to share and to impact people's lives. We've worked with the Huffington Post. We just did a story on when mental health is scarce and about faith communities playing a role in meeting that need. We love our local health department and work actively with them for naloxone and naloxone training for our staff and others. We also have, I'm able to announce, we just actually penned this agreement last week, but the UAB School of Nursing is going to open up a clinical site that changed lives. And every Tuesday night, the homeless community will have a targeted approach. One night it'll be women's health. One night will be diabetes. One night will be a dental night. One night will be, we even have physical therapists. So these are individuals who won't go to a hospital unless an ambulance takes them. But they'll come to Changed Lives because why? They feel safe, they feel loved, and they know that we have what they need when they need it. We can't do that on our own. That requires playing well with others. And so as I share some of the outcomes briefly here, I couldn't decide what to call my presentation today. At first I was going to call it an unlikely story because it really is an unlikely story for myself and the Foundry. But I chose the title, Playing Well with Others, because I think it really sums up what we've talked about today. If you can't play well with others, you might want to rethink what you're called to do. So the efforts and outcomes from our collaborative continuum of care. I told you about the dental clinic. I've told you about some of the targeted health populations. I want to talk about the recidivism rate for men coming out of the Alabama Department of Corrections through our recovery program. We were able to reduce recidivism by approximately 40% by providing the next right choice and walking them through that and wrapping those services around them. Also, from a harm reduction standpoint, as far as opioid overdoses, we buried a lot of people last year. People trying to get in the program, people who were in our program, people who should have been in our program. And as the bell tolls, I want to talk about harm reduction. For someone in our recovery programs, or someone who walks through our door at the Foundry, because of the continuum of care, because of our partners, because we're willing to work or play well with others, 75% of the people who walk through our door stay for 12 weeks. 52% of the people who walk through our door stay for 24 weeks. 40% of the people who walk through our doors stay for 40 weeks. And then 27% of the people who walk through our doors stay for an entire year. This is an option that the state of Alabama and other states in our country cannot provide. Faith-based communities, volunteers, organizations, and ministries are equipped to walk the extra mile with those who need a friend. So get out of your offices. If you're a faith-based provider, get out of your office and go meet the clinicians. If you're a clinician, take your team to a faith-based organization and make a friend. We'll be able to help a lot more people. Amen.